Victor Wong is a pharmacist also in Toronto, and he's joining us now to talk more about the changes that are to come. Victor, thank you so much for making time for us.
It's a pleasure, Natasha.
Victor, let's begin by getting your initial assessment. We know that the province back in January brought in a whole list of ailments that now pharmacists could treat and diagnose. 6 more added as of yesterday. Good news or bad news?
It's an absolutely great news. For instance, just this past weekend, I was on shift and we had a patient at 10 p.m. call us, and she needed a prescription for a urinary tract infection. Otherwise she would have had to wait maybe 2, 3, 4 hours. I think the average wait time for Ontario hospitals is about 3 hours right now, considering both urgent and non-urgent cases. And we're able to get her a prescription rather quickly, within about 10, 15 minutes.
Do you worry at all that now, because it's so difficult to get a family doctor, let alone get an appointment with one, that all of a sudden a whole bunch of people are just going to start streaming into the pharmacy, and then the long lineups are going to be there instead of at a hospital or at a clinic?
Well, we do think that there will be a pickup in terms of traffic. From our assessment, each assessment does take about 5 minutes, all the way up to about 30 minutes, depending upon whether it's a new patient, we don't know their history, or it's the first time seeing them. But this is a big difference for the patient, in contrast to waiting at a walk-in clinic where they may have to be waiting for an extra hour, 2 hours, or as the ER, as I mentioned, where wait times can be 2, 3, 4 hours upwards. So that little bit of extra time on our end can save a patient a lot of time. And I also do want to mention that in terms of the actual assessment process, because these are minor ailments, we do have streamlined algorithms that make sure that we do a thorough assessment that's very structured and covers all the bases. And for us, rather, it's not too long and not too much of a burden.
We heard from the Minister of Health that since this program was launched in January, 400,000 at least cases have been managed by the pharmacists of various ailments, and they're treating them. Can you tell me what are some of the most common things or some of the stories that have stood out for you at your pharmacy?
Yeah, by far, it's been urinary tract infections that have the most visibility on our end. Other things include items such as gastroesophageal reflux, also known as heartburn, bug bites, some seasonal allergies. So we're looking at diseases or illnesses that are rather acute, can be treated with just a thorough assessment, a structured assessment. But also conditions that generally people don't want to be waiting on a Friday night, a Saturday night, waiting until Monday morning in order to be able to get to their clinic, or waiting in a hospital ER. So it is really nice to be able to address a lot of these acute and urgent by the patient's standards, conditions, so that they don't have to wait in line and have to delay treatment.
So Victor, walk me through the process. If I'm not feeling well and I don't know, it's a tick bite or something, if I walk into the pharmacy, do I just go right up to the counter? Do I have to make an appointment? Is there a private space? How does this process work?
Oh, yeah, that's right. There's 2 main methods. It can be done either by walk-in, so individuals can just walk into a pharmacy and ask for the service. The pharmacist can screen you and assess if it's a condition that can be treated and prescribed right away. There are also a booking appointment basis, so individuals can book an appointment online and secure a spot so that they don't have to wait. And also it can be available virtually as well. So you can connect with the pharmacy on the phone or virtually through means like Zoom, similar to right now. We can get the prescription and do the assessment as well. So it's extremely convenient. And as the health minister mentioned, it is at no cost to residents of Ontario.
Victor, before we go, I want to read and share something with you. A very dear friend of mine who's a pharmacist, I've known her for 20 years. She wrote to me this morning, I love that our profession is being recognized for the expertise that we actually have, and it is finally being put to good use. So let me ask you, in all your years of experience, how has the role of the pharmacist evolved from your perspective?
I graduated almost 20 years ago. And I never thought that I would see this day come, and it's absolutely phenomenal. Now that we can prescribe for minor ailments, do assessments, manage chronic conditions, give vaccines such as COVID vaccines, flu shots, administer medications for treatment, and also do point-of-care testing. It's absolutely phenomenal that we can, as pharmacists, be able to provide this service and care to our community.
Well, we wish you luck, and thanks for taking on the extra work.
Thanks so much, Natasha.
You're very welcome. Victor Wong joining us from Toronto.